Hi, my name is Natasha Yoki. I'm one of the nurse practitioner students, and today I'm going to be doing a head and lung test.
All right.
Can you first start off by telling me your first and last name
Charles Fields,
and your date of birth?
02/19/2005.
Oh, good. Okay. Are you comfortable how you're sitting? Do you need to use the restroom before we get started?
No, I'm okay.
Okay. Is anything bothering you today?
Nothing in particular.
Okay, good. I'm going to do some hand hygiene. Alrighty. So our medical assistant out front got a full set of vital signs. She also got your height and weight. Height and weight looks good for your age. It hasn't changed over the years, which is good. Your blood pressure was 112 over 82. Heart rate was 73. Your respiratory rate was 16, and you're 98% on room air, which are all perfect vital signs. She also did a visual acuity test with the Snellen chart that tested cranial nerve to your optic nerve, and it looks like you have 20/20 in the right and 20/20 in the left. So that's all good news.
Nice.
All right, so let me just start off by doing a visual inspection of your skin, looking for any lesions, redness, dry patches, nodules, which I don't see. Also looking for macules, raised macules, papules, any vesicles. Taking a look down here at your fingers, your nail beds. I don't see any evidence of clubbing. Your cap refill is less than 3 seconds. And is there any tenderness here in your joints?
No.
Okay. Take a look at your skin there. Good. So if I did see any raised macules, I would be concerned about the asymmetry of them, the borders, irregular borders, the color, if they were evolving over time, and also the diameter, which we're worried if they get any bigger than 6 millimeters.
Okay.
So throughout the exam, I'll just be taking a look at your skin all throughout. Okay, so I'm going to start by just kind of touching your head here and popping the scalp, making sure I don't feel any lumps or abnormal bumps, nodules, depressions. Do you have any tenderness as I touch?
No.
Okay. Taking a look at your hair, it's very full and thick. There's good distribution. It's nice and clean, and I don't see any evidence of any infestations.
Nice.
All right. Moving on to your eyes, I'm going to test pupillary response. So go ahead and just look straight at me, and I'm going to shine light here. Good. Pupillary constriction, and same on this side. Okay, now I'm going to test if there is accommodation. So I'm going to look at the other eye as I shine on this side. So just look straight at me. Good. And look straight at me. All right. So pupils are equal, round, and reactive to light, and there is good accommodation on each side. And that is testing cranial nerve 3. Moving on to the fundoscopic exam. In the clinic, I would turn down the lights, but for filming purposes, we'll keep them on. Here I have my ophthalmoscope. And I'm going to have you just turn your body slightly towards me. Perfect. Okay. So go ahead and just look straight ahead. I'm going to put my hand on your shoulder and shine this bright light into your eye. And I'm just going to be getting kind of close to your face. Just head up. All right. So there's red reflex and coming inwards until I see the optic disc right there. Perfect. I see good vasculature. There's no hemorrhages or nicks. Check on this side. Okay, there's red reflex. In. Okay, there's optic disc. And no signs of any nicks or hemorrhages there. All right, sorry, I know that's bright. Okay, next I'm going to test cranial nerve 3, 4, and 6. So go ahead and just look straight at me. And I want you to follow my finger just with your eyes and not move your head. Okay, so starting here, up, back, okay. going in. Good. So good confrontation. All of your visual fields 3, 4, and 6 are intact. Okay. One of the specialty tests that we would do for pediatrics is called the cover uncover test. And we'd have you cover one eye and focus on an object and then release the cover and see if that eye focuses inward on that object, and it's a test for strabismus. Okay, so let's move on to your ears. Starting with my visual inspection, just looking at the outer ear, looking for any redness or abnormal drainage, which I don't see. I'm just going to kind of tug here and press on the tragus. Do you have any tenderness?
No.
Okay. I'm going to test your hearing. This is a special test for unilateral hearing loss that I'm going to do with my tuning fork. It's called the Weber test. So I'm going to hit this fork and place it on your head, and you just tell me if you can hear it equally on both sides.
Yeah.
Good. All right. Next, I'm going to do the Renee test. So all I need you to do is just tell me when you stop hearing the noise, and I'm going to move it from the back of your ear right into the front.
It's gone. It's gone.
Gotcha. Other side.
It's gone. It's gone.
All right, excellent. So bone conduction is greater than air conduction, which is usually a 2-to-1 ratio, which is expected. Okay, now I'm going to take a look in your ears, which now I'm realizing I normally would look into your ears first, just to make sure that it's not impacted with any cerumen before I test your hearing. But you don't appear to have any signs of hearing loss, so that's good. But I'm going to just take a peek. No tenderness as I press. Does it feel tender at all?
No.
Okay. Just going to take a look. All right. So membrane, the tympanic membrane is pearly and gray. The canal is clear. There's just mild cerumen. This side from the ear up and back. All right, canal is clear. There is a little bit of cerumen. There we go. Tympanic membrane is nice and pearly and gray. I don't see any bulging. Okay, very good. All right, give this guy a little clean. Okay. So moving on, I'm going to do a visual inspection of the eyes, which I didn't do earlier, and just checking for any abnormal lesions, swelling. Your sclera is nice and white. I'm going to just tug onto your bottom of your eyelids here. I'm looking at your conjunctiva is nice and pink. Looking at your nose, I'm going to palpate your sinuses here, frontal and maxillary. Is there any tenderness there?
No.
Okay. Nose is nice and straight, and the bridge is midline. I'm going to have you just tilt your head back for me, and I'm going to take a peek in your nose. So the septum is midline, and the mucosa is nice and red, and it looks clear and patent. Okay. While I'm here, I'm going to palpate your temporomandibular joint. So go ahead and open and say, ah. Good. And did you have any tenderness in this area?
No.
Okay. And I didn't feel any clicking as he opened and closed. All right. Now take a look at your mouth. So you can just open for me. Good. This patient has good dentition. The oral mucosa is pink and moist. Go ahead and stick your tongue out for me. Okay. Uvula is midline, and that's cranial nerve 11. And stick your tongue out. Cranial nerve 12. And then you can close and then just swallow for me. Perfect. That is testing cranial nerve 9, your glossopharyngeal. Okay, before I move on, I just want to palpate your lymph nodes here. So you just let me know if you feel any tenderness, and I'm looking for any swelling or kind of hardness or bumps in these areas. So this is preauricular, postauricular, tonsillar, occipital, submandibular, and submental. Do you have any tenderness in those areas?
No.
Okay, this is supraclavicular and infraclavicular. And I didn't feel any bumps or hardness in any of those areas. Okay, I just want to do a couple of range of motion tests in your neck before we move on. So go ahead and just put one shoulder to one ear to each shoulder. Good, and then shrug your shoulders up. All right, and go ahead and relax. That's testing cranial nerve 11, your accessory nerve. And can you tilt your head back and then forward? Good. Okay, and then don't let me move your head, and I'm just going to kind of be pushing in opposition. So push your head into my hand and then resist. Perfect. Resist, and then going forward, and then going back. Good. Good. 5 out of 5 strength. Okay, one of the specialty tests that is testing for cervical radiculopathy is called the Sperling test. So I have my patient just put one ear to the shoulder. So go ahead and place this ear like so, and I'm going to put some slight pressure down on your head, and you let me know if you feel tingling or numbness on this side.
No.
No? Okay, and we're going to switch and put a little pressure. Any tingling or numbness on this side?
No.
Okay, so that's a negative Sperling test. All right. Before I move on, I do want to test one last cranial nerve, which is the facial nerve, cranial nerve 7. So go ahead and just close your eyes, and I'm going to touch, and you let me know if it's equal on each side.
Equal?
Yeah, equal.
Mm-hmm. Equal.
Good. There and there.
Yeah.
All right. Very good. And again, for cranial nerve 7, I want you to just raise both eyebrows. Good. Squint, both eyes closed. Puff out your cheeks and smile. Good. There's good symmetry. So cranial nerve 7, your facial nerve is intact. Okay. So moving on to the posterior chest, I will have you probably just turn this way so your back is facing forward. Perfect. Okay. Just a little bit. All right. So just doing my visual inspection of the back, looking for any lumps or tenderness, any tenderness in these areas.
No.
So just look at your skin. Is nice and even. I don't see any macules or papules, and no lesions, no swelling. The spine is nice and midline. Do you have tenderness as I go down the spine?
No.
Okay. Good. I'm going to do a test for CVA tenderness. So you just I'm going to tap on your back kind of hard here, and you let me know if it's tender at all.
No. No.
Any tenderness? Okay, great. Okay, I'm going to do a test called thoracic expansion, just making sure that you have equal chest rise on both sides. So go ahead and take a nice deep breath in for me. And out. Okay. And I'm going to have you kind of give yourself a hug here and open up your scapula, and then try that one more time for me. Perfect. All right, so good. Equal rise on both sides. Go ahead and relax. I'm going to do a test called tactile phrematist, checking for any consolidation in the lung fields. When you feel my my hands on your back, just say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. So that is also referred to as whispered pectoraliloquy. Bronchophony uses the words 99, whichever works well. You're just testing for it to be equal, the vibrations to be equal felt in your hand throughout the lung fields. Okay, next I'm going to be doing a little bit of percussion and just checking for good resonant sounds throughout all the lung fields. Good. All right, I'm going to be doing a test for thoracic expansion. So once again, if you can give yourself kind of a hug and kind of just shrug forward slightly, I'm going to have you take a nice deep breath in and exhale. And then one more time, inhale and hold at the top, please. Okay, good, and relax. To mark this area. Okay, and take a nice deep breath in and out. One more time, in and out, and hold. There's the dullness. You can relax and go ahead and breathe. Okay. So this area, I'm going to get my ruler. And it's just about 4 centimeters, which is an expected finding. Okay, go ahead and relax your arms. Alrighty, I'm just going to take a quick listen into the lung fields. Whenever you feel my stethoscope, just take a nice deep breath in. Just lift under your shirt here, get onto your skin. Go ahead and deep breath in. And the lateral sides. All right. So lung fields are all clear. I didn't hear any adventitious lung sounds, and there's good, clear air movement, which is great. All right. Moving on to the anterior chest, I'm going to have you turn your body to face this way. Excellent. All right. So same as the backside, just starting off with my visual inspection of the symmetry here. I don't see any use of accessory muscles. Your rate and rhythm of breath seems to be equal and controlled. I'm going to just kind of press on your chest wall here. You let me know if there's any spots that are tender.
No.
Okay, good, good. All right, I'm going to be doing some tactile fremitus. So when you feel my fingers, you can say the word 99.
99, 99, 99, 99, 99.
Good. So I felt good resonance, good vibration rather throughout. I'm going to do a little percussion. Right. Side. Clavicle. Great. All right. I heard good resonance throughout all the areas, no signs of consolidation. All right. So same as the backside, whenever you feel my stethoscope, just take some nice deep breaths in for me. Good. Gonna lift under your shirt here, just get on the sides. Excellent. Alrighty. I didn't hear any adventitious lung sounds. Your breath sounds are all clear through all the fields. Do you have any questions for me?
No.
Okay. Well, that concludes our exam for today. Thank you so much.
Thank you.